Hello, everyone. My name is Jennifer, and for this week's discussion board, we were to discuss just the different policies and laws as it relates to child welfare, um, reporting child abuse and neglect or suspected child abuse and neglect, and then just discussing what our current field placement agency policy is. I am currently located in Delaware, so as a social worker in Delaware and a social work intern, I would have to resort to the Delaware state law as it relates to suspected child abuse neglect. So, state law in Delaware requires that all suspected acts of child abuse neglect be reported to the appropriate authorities. Delaware has a 24/7 child abuse neglect line. It's a 1-800 number, 1-800 292 9582. And like I said, that is a number that is monitored 24/7. When you call it, there's always somebody there to answer. So you would just call that number and tell them what it is that you are suspicious of or your concerns, things like that. The important thing to remember is that you have to make this call in the state of Delaware. You cannot just do an investigation on your own. Because the role that we have as a social worker, especially in my current capacity, I'm not a child welfare investigator. So it's very important that you make that call so that the proper investigation can be started and then, resources put in place, things like that to protect the children. As it relates to my internship, I currently intern for the Wilmington VA Medical Center. I'm stationed in the Dover clinic. The VA has their own policy as it relates to reporting suspicions of child abuse neglect. They also have that to include any kind of like sexual trauma as it relates to children. They have their own policy, and it just simply says that all VA covered professionals, while acting within the scope of their VA employment, are required to adhere to federal and state requirement laws which govern the reporting of suspected cases of abuse or neglect. The VA also, in their policy, they put in some preventative measures such as mandatory training on reporting requirements for all VA mental health and primary care providers. Policies are also established and in place to implement directives during suspected abuse to ensure appropriate reporting is completed by federal and state standards. So the VA of the U.S. Department of Veteran Affairs is considered a federal entity, but we would resort to our state, local level laws when it comes to reporting. So, like I said, we would call that 1-800 number. But with the VA being a federal entity, when I was reviewing the policy, I saw that there was a lot more information and guidance on how we can disclose the information. So it just says that it also includes training to inform staff of federal state reporting laws. And it also includes the VA's legal authority to disclose information for the reports. The training also includes what kind of information can be released and then the follow-up steps for documenting abuse. The VA is very protective of veteran information. So as I was reviewing the policy, it just talked about we can never disclose veteran health records. It's another step in policy and procedure you would need to do to release those records. And then it's very specific what can be released during the report for suspected child abuse. And it was a lot of detailed information that I wouldn't have time to share with you, but it's just, that's the one thing I got from it was that when we make the report, you have to give them the facts of what's happening, but try to only disclose what it is that's happening and nothing else. And then social workers in the VA are responsible for another initiative for prevention care is just utilizing social workers to do assessments where they can identify any kind of psychosocial risk factors that may require an intervention for anyone experiencing abuse. Social workers would also facilitate a referral for any clinical assessment, treatment, or care for individuals, and then maintain a list of VA and community resources that provide or arrange for evaluation of care for individuals experiencing abuse. And then, as it relates to client self determination, according to our social work code of ethics, social workers respect, promote the rights to clients for self determination, except for if their self determination is causing harm to themselves or someone else. So, as it relates to suspected child abuse or neglect, while the client always knows what's best for them, if they are doing something that is harmful to their children or other people in their lives, then we have a duty to step in and help protect those that are being harmed. And then we can just, work on educating the client while this may be what you feel is best for you, it goes against the laws for the state. So how can we help you get to a point where you can still do what's best for you, but follow the law?